Hello, my name is Kira Huron, and I chose to do my case study on stress and anxiety disorders. We're going to start off with some simple definitions. Stress is a response to an adverse or very demanding situation that typically shows itself through mental or emotional strain. Anxiety is a reaction to that stress, which causes an individual to feel worried, nervous, or uneasy. You may ask, what are stress and anxiety disorders? Well, according to the American Physiological Association's website, stress disorders can present themselves in three stages. The first is acute stress, and that is an event that will happen in your daily life. So it could be something like being stuck in traffic and late for work or missing an important deadline. The second is episodic acute stress, and this is constant. So it's a constant overload. I would describe it as a series of unfortunate events, basically. So you're having a bad day, a bad week, a bad month. The last is chronic stress. So this is a result of unrelenting demands and pressures of life, and it happens day to day, month to month, year to year. It's not a phase, it's your life and it consumes you. Anxiety disorders are characterized by excessive fear and avoidance, typically in response to a specific object or situation, but in reality, there is no danger or life-threatening circumstance, even though it feels that way to the individual. Some examples of stress disorders are PTSD, which is post-traumatic stress disorder, acute stress, episodic acute stress, and chronic stress, which we just discussed in the previous slide. Anxiety disorder examples would be generalized anxiety disorder, panic disorder, obsessive compulsive disorder, which is OCD, phobias or irrational fears, and social anxiety disorders. So signs and symptoms of stress and anxiety disorders are very similar. They can manifest themselves in physical and emotional outlets. Physical stress disorder signs and symptoms would include headaches, grinding of the teeth or locking of the jaws, tremors, lightheadedness, frequent infections or sickness, muscle aches and pains, difficulty breathing, nausea, and fatigue. Emotional cues would be depression, increased anger, increased worry, difficulty concentrating, feeling overwhelmed, and usually people are all over the place and very disorganized. For anxiety disorders, physical signs and symptoms would include sweating, pounding of the heart, headaches, upset stomach, dizziness, shortness of breath, muscle tension, tremors or twitches, and fatigue and insomnia. Then emotional manifestations would include feelings of apprehension or dread, anticipation of the worst, difficulty concentrating, feeling tense, jumpy, or irritable. So you may wonder how stress and anxiety disorders come about, and there are three possible origins. The first is a traumatic event, so it could include something such as a car accident, a death, experiencing a serious illness. You could experience mental, physical, or sexual abuse, environmental disasters. So all these things are huge events that really just impact your normal daily living. Second is a genetic component, which according to the Neuroscience Journal, there is a 30 to 40% of stress and anxiety disorders have a hereditary component, which means that the gene is passed from father or mother to the child, and there's a predisposition for that individual to develop a stress or anxiety disorder. The last component is an environmental stimulus. So these could be things as simple as financial burdens, stressors at work, social stressors such as being in crowds, talking to new people, public speaking, all of those types of things. We're going to talk briefly about prevalence for a second. I thought it was interesting that women are 60% more likely to experience stress and anxiety disorders. And sadly, the average age of onset is as young as 11 years old. If you look on the prevalence chart to the left, you will notice that there is a lifetime prevalence in the United States of 28.8, which is kind of a lot. So in order to diagnose stress and anxiety disorders, there are a lot of different procedures depending on the disorder, but some examples of what steps you may have to go through in order to be diagnosed would include a physical signs and symptoms examination. Doctors can order blood and urine samples to be taken, and they'll look at the lab results. So they'll look at things such as your hormone levels, like your cortisol could be really high, which would be an indicator of stress. They'll ask detailed questions about medical history and symptoms, and they can use psychological questionnaires to see what your mental status is. There are a couple treatment options which can be used interchangeably. They can all kind of be used together. The first is self-care. That would include anything that would involve taking care of yourself that is on your own accord. So this would be eating healthfully, getting a good night's sleep, and exercising. The second is therapy, which there are many people who have studied specifically stress and anxiety disorders and learned how to provide good guidance and care. The last is medications, which would be pharmaceutical prescriptions that help the individual with the stress or anxiety disorder to manage their symptoms and the disease on a daily basis. Today we're going to focus on PTSD, or post-traumatic stress disorder. So PTSD is a mental health condition caused by experiencing a traumatic event. According to Anxiety and Depression Association of America, their website, there are 3 criteria for diagnosis. The first is re-experiencing a traumatic event, so you might have flashbacks or nightmares about the event. The second is avoidance, so you avoid certain behaviors that remind you of the traumatic event you experienced. And the third is increased arousal. So you might have difficulty concentrating, difficulty sleeping, you can become irritable, and you can become very angry. Symptoms of PTSD include mental flashbacks, nightmares, insomnia, anxiety, fear, and isolation. Treatment for PTSD would include medication, which would be SSRIs, as well as therapy. So the medication, as I said before, that people prescribe for PTSD are SSRIs, which means selective serotonin reuptake inhibitors. The purpose is to ease symptoms of depression and anxiety. There usually aren't any complications during exercise as a result of consuming SSRIs. And some examples include Zoloft, Paxil, Lexapro, and Prozac. So SSRIs work by, number one, increasing serotonin, a neurotransmitter, the levels in your brain. 2, they block the reuptake of serotonin. And 3, they make serotonin more readily available. So serotonin is a neurotransmitter that helps control mood, behavior, appetite, sleep, and memory. So what the drug actually does is helps to release serotonin from the presynaptic nerve into the synapse. And then in the synapse, the serotonin is available for the postsynaptic nerve to accept it or absorb it and carry that message along to the next neuron. Sometimes what happens is serotonin is not completely absorbed from the postsynaptic nerve, and some of it remains in the synapse. Normally, the serotonin is reabsorbed into the presynaptic nerve, but what the SSRIs do is prevent the reabsorption or reuptake of serotonin in the presynaptic nerve, making it more readily available to the postsynaptic nerve because it's just floating around in the synapse waiting to be absorbed. Today, we're going to look at a case study of a female who is 22 years old. She doesn't smoke. She does have high blood pressure, which is something to be careful of. Her BMI is normal. She is sedentary, which is also something to take note of. She has no family history of cardiovascular disease or coronary artery disease. Her cholesterol levels look great, as well as her fasting blood glucose. She is on 2 medications, Zoloft and Paxil, and her medical history shows that she was in a severe car accident where she witnessed her mother passing away, and that caused her to be diagnosed with PTSD. Her goal is to reduce the occurrence of anxiety in her daily life, increase her sleep at night, and adopt exercise into her lifestyle. This would cause her to have a low-risk classification. So when proceeding with this client, first of all, I want to be very careful of what exercises I have her perform, because for most stress and anxiety clients, they are usually triggered. Their symptoms can become triggered through exercise. So I would start her off very slow. She is normal body weight. She is inactive. So I just want to get a feel for where she is at, which is why I wanted her to do the 6-minute walk test, because it doesn't put a lot of pressure on her, as well as a max push-up test, a max lat pull-down test, and a max body weight squat in 1-minute test. For her exercise prescription, her aerobic fitness is going to be number 1 for me to concentrate on, because according to the Mental Health and Physical Activity Journal, having PTSD clients perform aerobic activity is a positive thing for their symptoms, because it exposes the feared bodily sensations or symptoms of PTSD in a controlled environment. So it helps them become used to it. As a result, I prescribed 40 to 60 minutes of low to moderate exercise 4 to 5 times a week, and I want it to be fun activities that don't put a lot of stress or anxiety on their plate. Balance and flexibility are also going to be important in her prescription, because according to PubMed, a mind-body practice PTSD article was posted, and it showed that mind-body practices such as yoga, stretching, tai chi, qigong, those types of activities help to reduce anxiety, stress, depression, and anger, and increase relaxation, energy, cope with stress, and help self-esteem. So that would also help loosen up muscle tension. Resistance training would kind of be progressive. I would start off with 1 day a week and work up to 2 to 3, hitting all major muscle groups, and just start off with machines, bands, and light weights just to get her form good. Because she has a lot of anxiety from her PTSD, I would try and work out with her so it doesn't seem like I'm staring at her, and she feels comfortable and like we're doing this together. And I would constantly be asking her if she was okay and felt comfortable.